Kaposi sarcoma, or KS, is a cancer that affects the cells lining blood vessels and lymph vessels. People with KS develop lesions, which are abnormal growths of tissue. These lesions can appear on the skin or inside the body. KS is caused by a virus known as human herpes virus 8, or HHV8. Most people with HHV8 don't get KS, but those with weakened immune systems are at risk. There are different types of KS, depending on the cause and who it affects. The most common type is AIDS-related KS, which affects people with HIV/AIDS. KS can affect different parts of the body, including the gastrointestinal or GI tract. The GI tract includes the mouth, esophagus, stomach, intestines, and rectum. When KS affects the GI tract, it can cause problems with digestion. Lesions can grow in the walls of the GI tract, leading to bleeding or blocking the passage of food. It's important to note that not everyone with KS will develop GI involvement. However, it's something to be aware of, especially for those with weakened immune systems. Symptoms of KS in the GI tract can vary. Some people have no symptoms at all, while others experience a range of symptoms. These can include abdominal pain, nausea, vomiting, diarrhea, and blood in the stool. Abdominal pain is a common symptom and can be either a dull ache or a sharp stabbing pain. Nausea and vomiting can also occur, often caused by lesions blocking the digestive tract. If you experience any of these symptoms, it's important to see a doctor. Early diagnosis and treatment are crucial for managing KS. Diagnosing KS in the GI tract can be challenging because the symptoms can be similar to other conditions. If a doctor suspects KS, they will perform a physical exam and ask about the patient's medical history. To confirm the diagnosis, a biopsy is usually needed. This involves taking a small sample of tissue from the affected area and examining it under a microscope for the presence of KS cells. Endoscopy is a common procedure used to diagnose KS in the GI tract. It involves inserting a thin, flexible tube with a camera into the digestive tract, allowing the doctor to visualize the lining and take biopsies if needed. Section 5. Treatment options, a multifaceted approach. Treatment for Kaposi sarcoma in the gastrointestinal tract depends on several factors. These factors are crucial in determining the most effective and personalized treatment plan for each patient. These include the location and size of the lesions, the patient's overall health, and their medical history. Understanding these elements helps doctors to tailor the treatment to the patient's specific needs. Another critical factor is whether the Kaposi sarcoma is related to HIV or AIDS. This relationship can significantly influence the treatment approach and the expected outcomes. Treatment options may include surgery, chemotherapy, radiation therapy, and antiretroviral therapy, or ART. Each of these treatments has its own set of benefits and potential side effects. Antiretroviral therapy, or ART, is particularly important for patients with HIV or AIDS-related Kaposi sarcoma. ART helps to control the HIV virus, which in turn can help manage the Kaposi sarcoma. Surgery may be an option for small, localized lesions. This approach can be effective in removing the lesions and preventing them from spreading. Chemotherapy and radiation therapy can be used to shrink tumors and relieve symptoms. These treatments are often used when the lesions are more widespread or causing significant symptoms. Antiretroviral therapy is crucial for people with HIV or AIDS-related Kaposi sarcoma. By controlling the HIV virus, ART helps to strengthen the immune system and slow the progression of the disease. ART helps to control the HIV virus, which is essential in managing Kaposi sarcoma. A stronger immune system can better fight off infections and other complications. Strengthening the immune system is a key goal in the treatment of Kaposi sarcoma. A robust immune system can help slow the progression of the disease and improve the patient's quality of life. By combining these various treatment options, doctors can create a comprehensive and effective treatment plan. This multifaceted approach aims to manage the disease, alleviate symptoms, and enhance the patient's overall well-being. Section 6. John's story, a journey of courage and hope. John, a 52-year-old accountant, first noticed blood in his stool during a routine checkup. He dismissed it as hemorrhoids, but the bleeding persisted. Further tests revealed lesions in his rectum, a diagnosis that shook him to his core. John's doctor diagnosed him with KS. The news was overwhelming, but John faced it head-on with courage and determination. He underwent a combination of chemotherapy and radiation therapy to shrink the lesions. Today, John is living a full and active life. While KS is a part of his story, it doesn't define him. Section 7. Prevention, lowering the risk. While there's no guaranteed way to prevent Kaposi's sarcoma, KS, there are several proactive steps you can take to significantly lower your risk. Prevention is always better than cure, and understanding the measures you can adopt is crucial. For individuals living with HIV/AIDS, the most effective strategy to prevent KS is to adhere strictly to antiretroviral therapy, ART, as prescribed by your healthcare provider. ART is a powerful tool that helps to keep the HIV virus under control. By controlling the HIV virus, ART strengthens the immune system, making it more resilient and less susceptible to opportunistic infections like KS. Regular monitoring and consultations with your healthcare provider are essential to ensure the effectiveness of the treatment. In addition to medical treatments, maintaining a healthy lifestyle plays a vital role in lowering the risk of KS. A robust immune system is your best defense, and this can be achieved through various lifestyle choices. This includes eating a balanced diet rich in fruits, vegetables, and whole grains, which provide essential nutrients that support immune function. Regular physical activity is also important as it helps to keep your body strong and healthy. Additionally, ensuring you get enough sleep each night is crucial for overall well-being and immune health. It's also important to avoid contact with the saliva and other bodily fluids of people who have KS, as the virus can be transmitted through these fluids. Practicing good hygiene and taking necessary precautions can help minimize the risk of infection. Engaging in safe sex practices such as using condoms and avoiding the sharing of needles are critical steps in reducing the risk of HHV/AIDS infection, which is associated with KS. By being mindful of these practices, you can protect yourself and others from potential transmission. Community health programs and support groups can also provide valuable information and resources to help you stay informed and proactive about your health. Educational workshops and seminars can offer guidance on best practices for prevention and management of KS. In today's digital age, accessing reliable health information online and seeking virtual consultations with healthcare professionals can further empower you to take charge of your health. Staying informed and vigilant is key to lowering the risk of KS and maintaining overall well-being. Section 8. Living with Kaposi Sarcoma. A message of hope. Living with Kaposi Sarcoma, or KS, can be a daunting journey, but it's crucial to remember that hope and support are always within reach. Living with KS can be challenging, but it's important to remember that you're not alone. There are countless individuals and communities ready to offer their support and share their experiences. Whether it's through in-person meetings or online forums, connecting with others who understand your journey can make a world of difference. Support groups and online communities can provide a safe and supportive space to connect with others who understand what you're going through. These groups offer a platform to share your feelings, ask questions, and receive encouragement from those who have walked a similar path. The sense of belonging and understanding you gain from these interactions can be incredibly empowering. Advances in treatment have significantly improved the outlook for people with KS. Researchers and medical professionals are continually working to develop new therapies and improve existing ones. These advancements mean that many people with KS can now look forward to better health outcomes and an improved quality of life. With early diagnosis, appropriate treatment, and a positive attitude, many people with KS can live long and fulfilling lives. It's essential to work closely with your healthcare team to develop a treatment plan that's tailored to your specific needs. Regular checkups and staying informed about the latest treatment options can make a significant difference in managing your condition. It's important to focus on the things you can control, such as managing your stress, eating a healthy diet, and staying active. Incorporating mindfulness practices like meditation or yoga can help reduce stress and improve your overall well-being. Additionally, maintaining a balanced diet and regular exercise routine can boost your immune system and enhance your physical and mental health. Remember that you are stronger than you think, and there is always hope. Every small step you take towards managing your health and well-being is a victory. Surround yourself with positive influences, stay informed, and never underestimate the power of hope and resilience. Together we can face the challenges of KS and emerge stronger. Section 9. Conclusion. A future with hope. Kaposi sarcoma, while a serious condition, is no longer the death sentence it once was. With increasing awareness, early detection and advanced treatment options, individuals like John are living proof that life with KS can be fulfilling and meaningful. Remember, knowledge is power. Understanding the disease, its symptoms, and prevention strategies is the first step towards a future where KS holds less power over our lives. Let's continue to fight for a future filled with hope and health.